Organizational Behavior in Healthcare. Welcome to the lecture segment of Sarit Podcast. Today we are looking into organizational behavior in healthcare, lecture 1. Here is what we will cover. 1. Understanding organizational behavior. 2. Individual and group dynamics. 3. Leadership theories. 4. Diversity, equity and inclusion in healthcare. 5. Managing organizational change. Segment 1. Organizational behavior. What is it? Organizational behavior, or OB, is an applied behavioral science that studies how people act in group setting. It provides tools to explain behavior in organizations, predict outcomes based on internal and external factors, help managers improve team dynamics and efficiency. Historically, OB emerged from the Industrial Revolution and evolved through the human relations movement to focus on how workplace relationships affect productivity. Segment 2. Leadership theories in OB. Two key theories by Douglas McGregor defines how managers perceive employees. Theory X. Employees are seen as lazy and dislike work, requiring control. Theory Y. Employees are creative, seek meaningful work, and thrive in collaborative environments. Understanding these theories help managers tailor their leadership styles for better engagement. Segment 3. Diversity, equity, and inclusion in healthcare. In today's diverse healthcare landscape, managing differences is crucial. Diversity refers to variations in age, gender, ethnicity, and more. Equity ensures fair treatment and opportunities. Inclusion creates an environment where everyone feels respected and supported. For example, healthcare providers must adapt the cultural differences to offer equitable and effective care. A key standard involves ensuring that healthcare services are responsive to diverse beliefs and communication needs. Scenario: imagine a patient using an unconventional method to administer insulin due to misunderstandings in instructions. This highlights the importance of cultural competency in healthcare setting. Segment 4. Managing organizational change. Change is inevitable in healthcare. Organizational behavior equips managers with strategies to address resistance to change, generational differences among healthcare workers, disparities in leadership roles such as the underrepresentation of women in decision-making positions. A systematic long-term commitment is essential to foster an inclusive and adaptive workplace. Segment 5. Practical applications in healthcare. To implement OBs effectively, healthcare organizations should focus on 1. Diversity management, creating policies to include employees from all backgrounds. 2. Cultural competency, training staff to handle diverse clients' needs. 3. Leadership development, promoting equity in leadership opportunities. Closing segment. Understanding organizational behavior is key to creating equitable, inclusive, and efficient healthcare systems. By embracing diversity and fostering strong leadership, we can improve outcomes for both patients and employees. Thank you for joining today's lecture segment of Sarit Podcast. Let's continue learning and growing together. Stay tuned for more. Don't forget to subscribe to the channels on all social media platforms. And the name is Sarit Podcast. Thank you.